last 1 week, some very good news has come through into the press, and that is about this new hospital which Medanta will be opening very shortly, hopefully in the next 3 years, as soon as they get the land, the go-ahead and the land work and all the deals and all, everything else is constructed and the construction undergoes. So once the hospital starts here, it will be a replica of what we have in Gurgaon, which is our flagship hospital. So this will be the Medanta of the East, and that is what we want to do. We want to basically extend excellent healthcare, excellent and affordable and sustainable healthcare to the Northeast, because this is where it is most needed, because there aren't very good medical facilities of the level that you deserve, that the population deserves. So that is the aim and that is the objective, and that is the reason why I'm here, that we talk about more about the hospital that we will be sort of constructing out here. Of course, it will take 3 or 4 years, whatever time it takes, with all the government help that we will hopefully receive. And then this hospital should be ready in 3 to 4 years. There will be all the super specialities. This will not be a hospital where Khasi and Jukham and Bukhar will be treated. I mean, of course, they will also be treated, but I'm saying is that there is enough already. So this will be a super speciality hospital where all the top-end specialities like cardiac surgery, transplant surgery, liver transplant, heart transplant, lung transplant, kidney transplant, all these knee replacements, everything will be done in one roof, into this hospital here. So now, in all this, all the super specialities, I am a vascular surgeon. So vascular means that I treat diseases of blood vessels. You know what are diseases? Does anyone know what are any diseases of blood vessels? Any diseases of blood vessels that you know? खून के नस का बीमारी कोई जानते हैं आप लोग? कोई सुना है? That these are big veins. These are veins which you see. You know these veins that we see on the hand. We all have them, right? Imagine these in your legs and 10 times the size. Big ones, big veins in the legs. So this is a problem which is called varicose veins, and previously we used to operate on these. Today surgery is not required. We can actually treat them without surgery with some what we call endovenous or endovascular techniques. That means we put in a catheter like a small little pipe like this, it goes inside the vein and the whole vein shrinks and it disappears. And it's a daycare procedure, which means the patient comes in the morning and 2 ghanta mein he can go back home. He comes in walking, goes back walking. So today, all branches of surgeries, previously surgery meant big operations, big cut from here to here and from legs everywhere, big operations. Today, most of the operations, because of technology, because of high-end technology, and of course assisted by all the computer technology that is available today, these procedures have become what we call minimally invasive. Minimally invasive means that they do not require open surgery, open cuts, open out any major surgery and in the hospital and staying in the hospital. So, as I said, varicose veins can be treated without any surgery or without any surgical procedure. We can do this with catheters and we can reduce the size of these veins. The other thing that is very rampant in India, even so in Assam also, they say almost about 5% of the population is affected by this. Do you know what is the incidence of diabetes in India? In Assam also, it's the same. Do you know what is the incidence of diabetes? To almost, they say 35 to 40 million people who will have diabetes in India by 2025. 25 million people is a lot of number of people, okay? So imagine even if 500,000 people are in Assam, 1 million people are in Assam who have diabetes. It is a major public health problem. Okay. Now diabetes, what is diabetes? Diabetes is only a number. Blood sugar बढ़ गया, blood sugar कम हो गया, blood sugar ज़्यादा हो गया, कम हो गया. That is all what diabetes is. But that is not all diabetes does to the body. It goes and affects every corner of your body. It affects your hair, it affects your eyes, it affects your brain, it affects your lungs, it affects your heart, it affects your kidneys, and it affects every organ in the body. So diabetes is like termite. You know Dimak? Dimak जानते हैं? Termite? Diabetes is like termite. It affects every part of the body. Okay? And you know why that happens? Do you know what connects the entire body? Everything is connected with one. Like, you know, today I can connect with you on my phone through wireless waves. So what are these waves on the entire body from the hair down to the toes? Every part of the body is connected to each other by blood vessels. So if these blood vessels get blocked, there will be disease, there will be problem, because the blood vessels are blocked. So this is what we do. I am a vascular surgeon. I try to open up the blood vessels which are blocked. And that is what vascular surgery is. That is what vascular disease is, and that is what vascular science is. Okay. Now this, unfortunately, is not available. This specialty is not available in the northeast, in the eastern part of India. It is not available. So this is something that Vedanta is wanting to bring here, so that people get this treatment options here. So diabetes causes blockages of the blood vessels of the body, and that is why people get, the blood vessels get blocked in the heart. You get a heart attack, right? Everybody knows that. Blood vessels, heart का नस बंद हुआ, heart attack. अगर किसी का brain का नस बंद हुआ तो क्या होगा? Stroke मतलब हम बोलते हैं उसको heart attack of the brain, जिससे stroke होता है. Stroke आप बोल रहे हैं कि उसका हाथ नहीं चल रहा, पैर नहीं चल रहा, पैरालिसिस हो गया, है ना? वो stroke हो गया. तो that is a heart attack of the brain. अगर किसी का पैर का खून का नस बंद हो जाएगा डायबिटीज के कारण, उसको क्या बोलेंगे? हार्ट अटैक ऑफ द लेग्स. आपने सुना है कभी हार्ट अटैक ऑफ द लेग्स? लेग्स का हार्ट अटैक, उसको लेग अटैक बोलते हैं. और ये बहुत सीरियस प्रॉब्लम है, क्योंकि हार्ट अटैक ऑफ द लेग्स होने से पैर का ब्लड सप्लाई रुकने से पैर को गैंग्रीन हो जाता है, डेवलप्स अ वुंड इन हिज फुट, any little toe or finger or wherever. Normally, if suppose you get hurt, how many days does the wound take to heal? 5 days, 7 days, maximum 10 days, but it will start to heal. Within 5 to 7 days, all wounds, normal wounds should heal, must heal. So if anybody has a wound which is not healing for 10 days or more, look for diabetes, look for blood supply, look for infection, make sure that there is no gangrene which is developing, which is the reason why the wound is not healing. Now, you may have heard about all this ballooning and stenting. Everybody knows about ballooning and stenting. But what does Medanta do? Where does Medanta fit in? Because ballooning and stenting, a lot of people are doing. So what is it that we do that which is different? Why are we here? Because we have to tell you that we are different, we have to show you that we are different, and we have to prove to you that we are different, and that is the reason the hospital is coming up, and I will tell you what do we do. So ballooning and stenting we all know. Today, there is technology that we have. I told you computer assisted technology. Today, we have technology. So, if I show you that there is an artery and there is cholesterol, the concrete has developed inside and the artery is blocked. Okay, so you go in with a balloon, you open up the artery with a balloon, put a stent and the artery is open. That's one way we all know.
मैं वैस्कुलर सर्जन हूँ मेदांता मेडिसिटी हॉस्पिटल गुरुग्राम से। मैं आज यहाँ गुवाहाटी में हूँ। ये खून की नसों की जो प्रॉब्लम है, उस खून की नसों के ट्रीटमेंट्स के बारे में मैं आपको, जो डिजीज़ हैं उनके ट्रीटमेंट्स के बारे में बताना चाहता हूँ। दो बहुत इंपॉर्टेंट ट्रीटमेंट्स हैं। एक तो वेरिकोज वेन्स होती हैं, जो बड़ी बड़ी नसें हमारी फूल जाती हैं स्किन के नीचे, पैरों में जो नसें फूल जाती हैं, उनको हम श्रिंक कर सकते हैं, उनको हम बंद कर सकते हैं, जिससे कि वो कभी फटती नहीं है और उनमें ब्लीडिंग नहीं होती है। ये वेरिकोज वेन्स हैं, जिसका ट्रीटमेंट बगैर किसी सर्जरी के, बगैर किसी ऑपरेशन के हम कर सकते हैं। नंबर 2, हमने बोला कि डायबिटीज़ जो है, डायबिटीज़ एक बीमारी सबको पता है, उसकी वजह से खून की नसें ब्लॉक हो जाती हैं, और खून की नसें ब्लॉक होने की वजह से आपके पैरों में ब्लॉकेज होके गैंग्रीन हो जाता है। जब गैंग्रीन हो जाता है तो पैरों में एम्पुटेशन करने का नौबत आ जाता है। तो हमारा ट्रीटमेंट से हम नस को खोल सकते हैं और उससे उसका गैंग्रीन को प्रिवेंट कर सकते हैं और एम्पुटेशन को प्रिवेंट कर सकते हैं। बलूनिंग और स्टेंटिंग तो सब जानते हैं, जो हम स्टेंट डालते हैं, बलूनिंग करते हैं, लेकिन मेदांता हॉस्पिटल में अब हम एक नया ट्रीटमेंट शुरू करा हुआ है हमने पिछले 1.5-2 साल से। एथोरेक्टमी बोलते हैं उसको, जिसमें कि हम नस के अंदर से उस नस को साफ कर सकते हैं और स्टेंट डालने का जरूरत नहीं पड़ता है या कम पड़ता है, और उससे हमारा पेशेंट का बेनिफिट ज़्यादा होता है।